What I want to say is thank you to everybody who went before me, so I'm going to put some premises out there. So the first premise that I want to put out there, the Center for Health Equity, what we work on is capacity building. So everything I'm talking about, the premise or assumption is that capacity building is part of it. I'm not going to go into detail about that because we don't have time to do that. So what I'm going to talk about today is a little bit about food security and how it reduces poverty. But having said that, I'm not a poverty expert, so just hang out with my cycle for me. So I know that most the people in the room are poverty experts, and so I'm not going to kill you with reading a definition, but what I did want you to look at is that food security is part of the definition. And then I gave definitions of what food security and food insecurity are. The concept basically is that people have adequate supply of food and that the food that they have are actually adequate nutritional value. So when you look at the statistics, they're very much in the light of what we talked about before, who has access and who doesn't. I think that's almost what everybody has talked about, access to different things. For the Center for Health Equity, what we try to do is talk to folks, though, not about populations that you're focusing on, but the resources that are available to those populations. So you'll notice that the populations that are listed up here, because we're hanging in the traditional research framework, starts with African Americans or blacks and Latinos, and then it moves on. So this is simple, very simple. That's why I said, uh-oh. I created like the simplest diagram you could ever create, and I saw his and I went, oh, mine's not that detailed. But basically it's just the premise that I think most folks in here would probably agree on, that there's a cycle between poverty and health and poverty, right? So if you're poor, you have poor health. If you have poor health, you're more likely to continue in a cycle of poverty. Food insecurity plays a role in that, and if we can change that dynamic or that indicator, we can change what happens in households, and we can change the poverty rate in households and whole communities. Someone else before me talked about and wrote a book indeed called Place Matters, and usually that's the whole premise of what I'm talking about, and that's what this presentation is about. The saying right there is almost exactly that. We constantly talk in the context of that people make choices within the context of the choices they're able to make. Here's something talking about food deserts, the idea that there's a lack of quality food or a lack of nutritious food in urban areas, in inner cities, and I liked the cartoon, so I put it up. So basically, what do you do to increase these? And this is a whole list of them, right? But in 6.5 minutes, I can't detail these, so what I'm doing is speaking to the last one. So all of these things are things that could increase food security, and they're all viable options, really. The one I think that you can do in 2 years, actually, is support existing stores to offer healthy food options. So I'm not coming up with anything new, right? In fact, I'm stealing other people's research because the Center for Health Equity, we're not invested in research at this point. We partner with other agencies that do that work. So I'm not creating anything new at the center. We're just trying to implement it. So I'm pointing out that there's other places that are doing the work. Policy Link is a great resource for this work, and stealing a lot from what they have. If we improve access to healthy food, all of these good things happen, right? The health improves, we decrease health inequities, we create and retain jobs, we improve local economic development, and we generate increased taxes. So basically what you're missing on that is it transforms the communities from an underserved community to a community of choice, a place that people want to be, a place that people want to live, and a place where you're not segregated from the resources that everyone should have access to. So in the city of Louisville, we have something called Healthy in a Hurry corner stores. We've done this on $10,000. Imagine what would happen if we actually had monies. There's money that conceivably be put into the federal budget, and what it's set up to do is provide monies like revolving loan sources for folks. So improving a corner store, you can improve a corner store so that it provides access to healthy foods for as little as $100,000, and in our community we're showing you can do it for as little as $10,000. Basically all we did with this particular corner store was gave them, we went and bought a new facade for them, and so they could take down the other advertising, go smoke, go drink. So they took that away and instead put up a facade for healthy foods so folks in the community knew they had access to it. We were able to provide them with refrigeration, because it's key in some of these local corner stores. And the thing that I'm missing and not giving you statistics on are access to foods. So in these communities, most people don't have access to the nutritional foods. So there's other things that you can do, actually. One of the things that you need to do is show that there is an unmet demand. And in Louisville, actually, we've had the ability to do that through several studies. including the drill down study by the gentleman who's going to step up behind me that their compact did for us, showing that, hey, there is a demand for this and there is monies available in the communities. If you provide the resources, people are there to pay for that type of thing. So the other thing is we need to subsidize the additional costs. What we find is that the grocery stores, while they're interested in doing this work, they're running on a minimal overhead, and their margin for error is quite small, just like the families that we're talking about. So we tried to help them, and we've helped them gain access to places where they can get their food at a reduced cost, and therefore they can continue to operate. What we haven't been able to do, but what I encourage folks to do, is to go and create a marketing manager for the city so that these corner stores have access to folks who can help them with things like that. So it's very important that you pick the right retailer. I have to say that the first group that we were going with, we found out, although we asked the question, we didn't have the paperwork in hand, we found out that they didn't have the ability to accept WIC vouchers. In fact, that had been taken away from them from the federal government, and they couldn't take SNAP. So if they can't do that, then they can't serve the people that we're looking for. And if they're unwilling to work with you on changing the environment of their store, they're going to be unwilling to work with you on other things. So it's finding the right retailer. So it's also promoting folks' participation, making sure that the residents are participating, that we know what they want, what kind of food they want, so that they're going to go buy it when it exists there. It's about providing other resources so they know how to use the food once it's in their communities. What you have access to is what you're used to using. It's a systems level change and an individual change. So then the final things is connect them with government resources. Don't just say go do it. We know it's a good thing to do, but make sure that you're giving tax incentives. Make sure that you're giving them reason and cash to do it. And there's a whole bunch of different things that PolicyLink has listed out that can talk about that. But since I have negative 30 seconds, I'm not going to detail that out.